Hi and welcome to morning stretching. In between the exercises, I'm going to read something about interstitial lung diseases and try to understand and learn it. And participating in the exercises is at your own risk, and interstitial lung disease is a severe, possible lethal disease. And I'm going to talk the whole time about cause, symptoms, and other diseases which can cause interstitial lung disease. I'm going to talk the whole time about diseases and symptoms of diseases. Let's start with the first exercise, if you want to. So, we are going down, breathing in. And we're breathing out. And we're breathing in. And out. And again in. And out. And again in. And out. Again in. And out. And again in. And out. And now for last round, we're breathing in. And out. And again in, out. Now we're closing the legs, and we have done the opening exercise. So we breathe always in through the nose, deep into the chest, and out through the mouth. So breathe in through the nose, into the chest, and out through the mouth. Now to the interstitial lung diseases. So interstitial lung diseases affecting the lungs. So by interstitial lung diseases, the lungs are affected. In the lungs are alveoli. The alveoli are air sacs in which carbon dioxide comes out of the blood and oxygen comes into the blood. The blood is in the alveoli oxygenated. So inside of the lungs there are alveoli. They are very small, and inside of these alveoli the carbon dioxide comes out of the blood and the oxygen comes into the blood. The blood is here oxygenated. So in the lungs are alveoli, and there in these alveoli the blood is oxygenated. The interstitium is the name of a tissue around these alveoli in which carbon dioxide comes out of the blood and oxygen into it. So, the alveolis, between these alveolis is a tissue. They are not all completely together, but there is a bit of space between them. And this space is filled by tissue, and the name of this tissue is interstitium. Interstitium. So, in the lungs there are alveoli, and in between all these alveolis, very much, there is a tissue, and this tissue is called interstitium. Next exercise, we're having the legs standing a bit more and shoulder wide apart. We are breathing in and lifting the arms up. And we're breathing out and going to the side. And now we breathe in and we open the rib cage. So breathe in. And out. And again in. And out back into the middle. And breathe in. And out to the other side. And breathe in and open the rib cage. And out. And again in. And out back into the middle. So, in the lungs there are alveoli. In these alveolis the blood is oxygenated. Carbon dioxide comes out of the blood and oxygen into them. And between all these alveolis, I don't know how many, but it must be millions or something, very much, there is a tissue, and this tissue is called interstitium. By interstitial lung diseases, the tissue called interstitium, which is around of the alveoli in which the blood is oxygenated, is affected. The tissue interstitium around of the alveoli is by interstitial lung diseases affected. By the Interstitium tissue around of alveoli affecting interstitial lung diseases, an abnormal healing process is triggered. So by interstitial lung diseases, the interstitium between the tissue between all these alveoli is in an abnormal manner healed. The healing process is triggered, but that happens abnormally, not how it is intended. It is intended that the human body produces just the right amount of interstitium tissue if something has damaged it. But by interstitial lung diseases, something disrupts the process of producing interstitium tissue around of the alveoli. So normally this tissue, if there happens some damage for something, for an infection or something, is normally repaired in a steady and good pace. But by interstitial lung diseases, this process is disrupted. It is not in order how it should be. It is triggered in an abnormal manner, this tissue replacement. The next exercise, we're having the legs standing again a bit more from shoulder wide apart. We're breathing in. And out, and one hand slides down the leg and the other shoulder stays down. And we're breathing in. And out, and we're taking the arm over. And we breathe in and we open the rib cage. So breathe in. And out. And again in. And out. And we're breathing in. And out, and the other hand slides down the leg and the shoulder stays again down. And we go into the other side. And breathe in. And out, and we're taking the arm again over. And breathe in and out in the rib cage. So breathe in. And out. And again in. And out back into the middle. So by interstitial lung diseases, the interstitium tissue between the alveoli in which the blood is oxygenated is not replaced at its intended pace and manner, but it's disrupted. It's not in order for happening, this displacement. And that leads to that by interstitial lung diseases, the interstitium tissue between the alveoli air-sacs becomes scarred, stiffened, and thickened. And that makes it harder to oxygenate the blood. So this tissue becomes stiffer, it becomes harder, it doesn't expand and it's not so elastic anymore. It becomes scarred, so like a scar. It's not smooth, good tissue, but it's scarred. And becomes harder, stiffer, and thickened, and becomes also thickened. And that leads, that it's not so elastic, and through that the lungs cannot expand so good, I think. It's not written here, I'm not sure if it happens. So written is here that the blood can't be oxygenated that good anymore, because the tissue around these alveoli in which the oxygenation happens is stiffer, harder, not so elastic, and scarred. And these all can't work properly anymore. Next exercise, we're having the feet standing together. We are breathing in and lifting our arms up. And we're breathing out and one hand comes down. And breathe in and reach to both ends. So breathe in and reach. And out. And breathe in again. And out and one hand comes down. And breathe in and reach. And out. And breathe in. And out, and one hand comes down. And breathe in and reach. And out. And again in. And for the last time, the hand comes down. Breathing in and reaching. And out. So by interstitial lung diseases, the interstitium, which is the tissue between all these alveoli, is not replaced in a manner and a pace which is intended, but it becomes scarred, harder, not so elastic, stiffened, and thicker. And that makes the oxygenation process of the blood, by which carbon dioxide comes out of the blood and oxygen into the blood, more difficult. The symptoms are shortness of breath, unproductive cawing, fatigue, and loss of weight. So shortness of breath, and the breath doesn't work so good. Unproductive cawing, so it is called, but it really brings everything. What the word means, I don't know what unproductive cawing actually means. Fatigue is some form of tiredness, but it's not just some sleepy tiredness, it's a long-term tiredness and a feeling of weakness. It's way more severe than just covered by a little sleep. It's not covered by a sleep. Fatigue is a long-term, not long-term powerless sleepiness, a form of tiredness and powerless of a long term, which is not recovered by a little sleep. And loss of weight, and an ungood loss of weight. Maybe it was intended, but this is an ungood loss of weight. And all these symptoms develop slowly over several months, so they don't just happen and they are developed slowly over months. The disease is lethal. The life expectancy of people who have it is 3 to 5 years. So people who have interstitial lung diseases, the interstitium tissue in between all these alveoli becomes harder and thicker, and they can't breathe very good anymore, and the blood gets not so good oxygenated. The life expectancy is 3 to 5 years if people have it. and in a moment causes. Now to the next exercise. We're having the legs standing wide apart. We're breathing in and out, and we are hanging down. And we're just hanging here and having only to come deeper by breathing deep in through the nose into the chest. And we're breathing out through the mouth. And we're going to repeat the cycle. So breathe in through the nose and out. And again in and out. And again in and out. We're changing over to one leg. And breathe in. And again out. And again in. And out. We're changing over to the other leg. And again in. And out. And again in. Out, back into the middle. We're breathing in. And out, we're coming slowly up with a round back, making at the top a backwards shoulder roll. Some symptoms are shortness of breath and fatigue. Unproductive coin, loss of weight. And the causes, in most cases, the cause is unknown. The cause is unknown in most cases. If it is known, there are some cases here. Mostly it is unknown, but maybe it can, sometimes it is known, and if it is known, it are these. Sarcoidosis. Sarcoidosis can be a cause, and sarcoidosis, we have a little explanation to some of these. An autoimmune disorder resulting in warm, swollen, now this is rheumatoid arthritis. Sarcoidosis, inflammatory cells accumulate in the lungs to lumps. So by sarcoidosis, inflammatory cells accumulate to lumps in the lungs. Now to rheumatoid arthritis. Rheumatoid arthritis, that is an autoimmune disorder resulting in warm, swollen, painful joints. So by rheumatoid arthritis, the joints, especially for fingers, are warmer, swollen, and painful. Lupus is another cause of interstitial lung diseases. The autoimmune system accidentally attacks its own healthy parts. So by lupus, the autoimmune system which should get rid of infections and some of inflammations and something. So the autoimmune disease gas drops in the human body. I don't know what it is exactly, but here it attacks the own healthy parts of the body instead of the bad parts. And it's not good to attack it. It's friendly fire, basically. Polymyositis, it's a chronic inflammation of the muscles. So polymyositis, the muscles, especially the skeletal muscles, are inflamed chronically. Dermatomyositis, it's an autoimmune disorder resulting in muscle weakness and skin rash. And we have a little explanation to skin rash, to the symptoms. Skin rash can be change of color of the skin, itching, warmness, bumpness, chappedness. Chappedness is that the skin cracks and or peels. Dryness, cracks, blisters, swelling, and pain. That is all dermatomyositis, an autoimmune disease resulting in muscle weakness and skin rash. And skin rash are all these symptoms. And pneumoconiosis caused interstitial lung diseases. And pneumoconiosis, that means it is caused through an inhaled substance. And these could be, for example, silicosis, and by silicosis, crystalline silicia dust. Crystalline silicia dust was inhaled. Then asbestosis, where asbestos were inhaled, asbestos were inhaled, and berylliosis. There was exposure to beryllium. And some types of infections can also cause it. In most cases, it is unknown what it is. And these would be, as infections listed here, COVID-19, pneumocystic pneumonia, tuberculosis, chlamydia trachomatis, and respiratory syncytial virus. Respiratory syncytial virus. So we're through with everything, but also through with the time we have for the morning stretching, so we're doing just the closing exercise. It's the opening exercise. So we're breathing in and out. And again in and out. In, out, again in, out. We're breathing in, closing the legs, and we're done with a short morning stretching. So interstitial lung diseases, by interstitial lung diseases, the interstitium, which is the tissue between all these alveoli, in which the oxygenation of the blood happens by bringing carbon dioxide out of the blood and oxygen into the blood. is not normally replaced if it has been damaged, but it becomes scarred, thickened, not so elastic, and that hinders the oxygenation process of the blood. The symptoms are shortness of breath. It leads in 3 to 5 years to death, and in most cases the symptoms are unknown. It can be inhalation of bad substances or infections or other types of diseases. Other diseases can cause this. In most cases, the reason for this interstitial lung diseases is unknown. I thank you very much, and until next time.